Shifting gears a bit, Representative Dean now moves that House File 2725 be re-referred to the Committee on Government Operations and Elections Policy. Representative Dean, we have the bill before us. To your bill.
Thank you, Mr. Chair and members. House File 2725 looks at county-based eligibility determination systems for MinnesotaCare and for Medicaid within our state public programs. This is a continuation of the work that I have been chiseling away at since MNsure became our state exchange program and has been rolled out. And part of that began with traveling around, as many of you have with me and on your own, to do cubicle ride-alongs in your counties, small counties and large counties, to sit with county caseworkers to actually see what the process for signing people up for state-funded programs, how that works, and how it works from the county side and how it works from your constituent side as they're going through that process. Much of this has been within the launch of MNsure and the inability for counties to be able to respond to that and to be able to help the people that they are chartered to do to help. And on typically what I would do in counties, some counties are small and some counties are large. Olmsted County has 100,000 people in it. Cook County has less than 5,000 people in it, but both counties have to kind of do the same thing in dealing with our state-funded programs, and that is trying to make sure that the families that need help get the help. When they go to CVS, their cards work, they get their prescriptions. When they go to the doctor, they can get seen and the doctor can get paid through our public programs. And it was through that process that I kind of started down the path of looking, instead of looking at DHS or at a new agency to try to figure this problem out, and it was clearly a problem of how to deal with this, to really look to the counties. And what I would typically do is meet in late afternoon with the counties at a hospital to try to get with county caseworkers after we would do a cubicle ride-along, then meet with county caseworkers at a hospital to try to get feedback at the end of the day so they could say kind of what was working, what wasn't working. And then we would do a town hall at night to hear from insurance brokers, business people, people trying to buy the insurance. And it was at one of those the third meeting in a county in western Minnesota that this kind of came from. And where it was we had the insurance brokers and the people from the counties were at the town hall, and they were talking to each other, and it was just a discussion that had broken out between the county caseworkers who were there and the insurance brokers. And the county caseworkers had discovered that they were talking to people during the day that needed to be on private health insurance, and they really couldn't help them. And the insurance brokers were saying, well, that's funny. The same thing is happening to me in reverse. I'm talking to people and trying to get them on public programs through my office, and they were trying to do each other's jobs through a system that was meant to integrate them that never, ever, ever worked and screwed it up for both sides. So what we kind of tried to look at was, okay, what's the solution here moving forward? And really there's two suppositions. Number one is that the idea is to separate private health insurance from the people in your counties that deal with people, families on our public programs, to get them out of the private health insurance business, if you will, and vice versa. So we create a new bright red line that says that we're going to do state-funded programs at the county level, and we're going to get them out of the private health insurance business, and we're going to allow private health insurance brokers to sell private health insurance to families who need it, try to get them more competitive products, and to separate those two. And the second idea, if you will, is to say, who is going to design this system moving down the road? Is it going to be the legislature imposing another agency on people and on counties? Is it going to be on an outside entity? Is it going to be DHS? Who is going to be actually figuring this out. And the idea with this is that there's the unit of government that is closest to the people, who's actually tasked with doing this job, is the county. That's how we're set up in the state. 87 counties, and all of them are responsible for delivering state-based program care to families. They had done this 10 years ago. They'll do it 10 years from now when hopefully most of us will be on doing other things. They're going to be the ones tasked with that job. And as I traveled around the state and talked to counties, actually small counties provided the best input because they were the closest to the families and they knew many of the families directly. And also the county caseworkers were involved in more than one program in smaller counties, and they provided the best level of support. So 5 years from now, 10 years from now, those same families are going to be in the 87 counties, and the county caseworkers are going to be delivering care. So if we're going to be spending hundreds of millions of dollars on IT for eligibility determination and for providing care, which we are absolutely, positively going to do, who is the best group of people to lead that process? And what this bill says is that it's the counties, because they're going to be closest to the delivery, and they're the group of folks who are directly accountable for that care. Now, that's the two main ideas of this. If this were a building that I was designing, this would be at the phase where you have a thick Sharpie marker and you would be kind of diagramming the building. That's the phase where this is at. That's the idea that we're going to be putting forward within this bill, is that the county should take the lead on designing their next system. So that actually is something that we can do for the counties rather than to the counties. And I don't blame counties for being skeptical. If I was a county, I'd be skeptical too, because the rug has been pulled out from under counties over and over and over again. You're understaffed, you're behind in trying to catch up. And okay, here comes another idea from government that's supposed to help us. And meanwhile, we're just happy if we can get a widget to work from the helpline, pretty please. So I do not fault anyone at the county level, local, small, or large, for being skeptical, as you should be, of any either fixed MNsure or replacement of it down the road. And so with that, those are the two main ideas behind this bill. And no matter who the next governor is, what the administration is, I am going to believe that we are going to have a pretty big change within how this gets done. And I would really like to put forward the idea that the county should lead. And so that, in a nutshell, is the bill.
Thank you, Representative Dean. I understand you have a couple of testifiers. If they could make their way down. Welcome to the committee. If you could please state your name for the record and your testimony.
Yep, Tim Jupp. So I'm one of those brokers that had those meetings, and you know, we were frustrated 4 years ago. You know, we've been involved with MNsure for a number of years, and it's been a frustrating process for the first couple of years. But the experience has changed. We work very closely now with people that can help clients get on the county programs or the Medicaids and the MinCares. You know, 4 years ago, it'd take us almost a whole day to get somebody enrolled in the process. Now it takes us about 20 minutes. And what we do, the process has changed for us too. We used to enroll a lot of people in the Medicaid program when we shouldn't be. But now we work closely with companies that's their expertise is to enroll people in the county programs. So we vet the people now on the phone, and we're getting these people calling us through the MNsure website, through our own advertising, and also from the county. The county's actually sending people our way now too. And we vet them on the phone and talk to them and see, are we the people they need to talk to, which is the broker? Should they come to us? Or should we send them on to the proper person, which is, we use mainly Portico is one of the companies that we use. And we send them over to Portico if it's a process that we can't do. So our experience from 4 years ago to today is much different. Like I said, we're seeing people getting the process done in about 20 minutes, but then also sending them to the proper channels and making sure people get the insurance that they need. So.
All right, thank you for your testimony, Mr. Jop. Are there any questions for the testifier? Seeing none, the committee thanks you for your testimony this morning.
Thank you.
Representative Dean, do you have other testifiers?
I think somebody from the counties would like to testify.
Welcome.
Welcome to the committee. If you could please
Good
state
morning.
your name for the record and present your testimony.
Yes, good morning, Mr. Chairman and members. My name is Hodan Guled. I am CEO at Briva Health. Thank you so much for the opportunity today. So Briva Health is a grantee and official partner of MNsure. Our partnership with MNsure has helped us build the largest outreach and enrollment program in the state. Our enrollment centers serve more than 25,000 Minnesotans per year. And our centers are actually open every single day, 9 to 5. We work year-round. We work with the counties and more than 100 community partners who refer people to us, who help us conduct outreach activities. So to date, we've actually conducted more than 1,000 outreach events that reach more than 80,000 Minnesotans per year to help them, educate them about MNsure and what their options are for coverage. As I said, we collaborate with more than 100 community partners who help us reach and refer consumers to our services, including the counties. As of today, we've actually helped more than 30,000 Minnesotans enroll on health coverage just at Briva. We're a small business. We have, more than 16 certified MNsure navigators who work very closely with the counties and with other, partners. Every month, more than 20,000 Minnesotans are helped by Minnesota's Navigator and Assister network, just like ourselves. And this would definitely not have been possible without MNsure and without the grant that we get from MNsure, which helps us go out there, educate the public, and help them understand what their options for coverage are. At Briva, we work with MNsure every single day. Like I said, 9 to 5, we're open year-round. We process, people who qualify for the public programs as well as the private programs. The county is one of actually our largest referrals, and it's definitely something that we do on a daily basis, 9 to 5. I can tell you, and I am here to tell you that we just completed our 5th open enrollment period with MNsure, and I can tell you that this year was MNsure's most successful year yet. MNsure is working better than ever in serving the unique needs of Minnesotans. MNsure continues to improve every single year. It has just set a record, as you all know, for signups this last open enrollment period, with more than 115,000 Minnesotans signing up for the private health plans, 60% of who received tax credits that average nearly $7,000 per year. And in total, Minnesotans are poised to save over $300 million in tax credits. This year, consumers' call wait times, which we call all the time because we are assisting consumers in person as well as over the phone, averaged less than 10 seconds. So when we call to help, to get something done over at MNsure, to either help a consumer change a password or help them push a case or help them with their application process if there is a need, it was literally taken 10 minutes for the MNsure staff to pick up. So that should tell you how efficient the team, the system have all become. At Briva, we know firsthand how far MNsure has come. We witnessed the tremendous amount of time and effort MNsure and its stakeholders, including us as well as the public who currently use MNsure, have really all put in to get to where it is today, to serve the unique needs of Minnesotans. So it's really imperative for us to continue to build on the success of MNsure and not risk families to lose the system and the services and the coverage that they've come to rely on, because now they're all on board. They finally know about MNsure. They finally know where to go. And as you all know, you just saw the probably one of the surveys that just came out, which pointed out, with the public programs, more and more people are enrolled than ever before. And it's all definitely because of the MNsure system and the MNsure program. So, many of these people who currently have health coverage would not have it without MNsure and its assisters like Briva. So this bill definitely takes us backward, guys. This bill is a solution in search of a problem, and it's unclear what benefit this new system will have. Given that the current system is working, creating an entirely new IT system is a waste of money. I think it's a waste of taxpayer dollars. Our goal here needs to be to make it easier for consumers to acquire health insurance, not make it more cumbersome, not make it more complicated, for them to restart and relearn everything all over again that we've worked so hard in the past 5 years to just be completely destroyed would be ridiculous. Now is not the time to go backwards. So I am here to just tell you that and to just let you know that we're here witnessing it firsthand for the last 5 years. We've put in all that we could to get MNsure to where it is, and we should definitely not go backwards and destroy what we've built together. Thank you.
All right, thank you, Ms. Goulet. Questions from members. Representative Franzen.
Thank you, Mr. Chair. Ms. Goulet, I see a different point of view on MNsure. I have constituents that call me. They're not happy. They don't like the runaround. They don't appreciate having to call various people throughout the state of Minnesota to get an answer, to facilitate. Most of the time they give up, and then they're calling their legislator with the hopes that we can find a secret channel that's not advertised to the public so they can get help just a little faster. If Representative Dean's bill, House File 25 or 2725 becomes a law, what happens to Abriva?
Ms. Goulet.
Thank you. So Briva is here. We definitely do not anticipate that this bill will pass because too many Minnesotans currently depend on MNsure. And too many Minnesotans know the system and have learned the system. I am here to tell you that over the 30,000 Minnesotans that we've helped enroll, they don't go all over the place. They now know a resource, a trusted resource that they can come to, that are there to understand their needs, that can serve them in multiple languages. We have more than, navigators that speak more than 8 languages. We serve Minnesotans all over the state. We currently have an online system where people can just set up appointments over the phone. We're able to help Minnesotans not just in the Twin Cities, but really in rural areas where if there aren't navigators, they can call us. The MNsure system has a portal system where a navigator can get on the phone and we can automatically assist them over the phone. And we've done it more than ever in this past open enrollment period.
Representative Franzen.
Thank you, Mr. Chair. Ms. Goulet, today is the first time I've heard of Abriva. So I don't think many of my constituents even know that Abriva exists. However, so what I'm hearing though is if this bill does happen to get passed into law, Abriva may not exist, correct?
Briva will continue, I'm sorry, and thank you for the next question. Briva will continue to exist because Briva's services are services that truly are used by Minnesotans, particularly in the places that we have existing offices, which is here in the Twin Cities. In Minneapolis, we have 2 offices, and in St. Cloud, we have another office. And then we have the capability, as I said, to assist, Minnesotans all over the state who need our services. Briva will continue to exist because we also work with other programs, other companies, and we provide other consulting services and other research type services. So we will continue, but we are very, I would like to say that I'm pretty sure that those 30,000 people that we've helped so far will be devastated if they found out that next year when the open enrollment period comes along, there's nowhere for them to go. And they will have to completely restart learning something that they don't understand. It literally took us years to go out there to tell people about MNsure, what MNsure is. how to sign up. I mean, we're for the first time ever signing up people who've never had health insurance before. So we are their source. We are their trusted source. They're coming to us for anything related to health insurance. And we're for the first time helping those people go to and get preventive health care instead of what they used to do was they used to just go in to the emergency room because they didn't have health insurance. But for the first time now, they have something where they can go in and get the care that they deserve for themselves and their families.
Representative Olson.
Thank you, Mr. Chair. To the testifier, so you serve the function of navigator. Is it easy to find a navigator? How would I go about finding, to Representative Franzen's point, in a community, like how are navigators found? Are you listed on websites? Are you publicly advertising? How easy is it to find a navigator in the state?
Exactly.
Ms. Goulet.
Thank you. So a lot of times the way people find us is multiple ways. So we ourselves get a grant from MNsure, which helps us go out there, advertise ourselves, collaborate with different partners all over the state, and they send people to us. So say, for example, if there is like a homeless shelter who has, people who have never had coverage, we would go out there, do, an outreach event there, tell them about what we do, and then they would learn how to get to us. So we distribute materials. That's one way. So from our end, and that's really made possible by the MNsure grant. The other option is if people go to the MNsure website, there's a really beautiful engine on there. You can go on there, put your zip code, your address, and then it pulls up all the navigators that are available. There's more than almost 1,000 navigators across the state that people can identify just through their address. And then the county has also we've become a resource for the county because, like, say, for example, if the county can get overwhelmed because there's thousands of people that would show up and, so we've kind of become a resource for them so that if they can handle it, they would also be sending people to us. So we have referral partners that have, been working with us. I mean, at Breva itself, we have more than 100 informal partners that work with us.
Representative Olson.
Thank you, Mr. Chair. And I hear that sounds very similar to what's true in my community, that you can go to our public library and literally stumble upon a navigator. You don't have to go to county services. They're throughout east to west. Our city's 20 miles long, and there's navigators in food shelves, homeless shelters, right where people are. So, it sounds like you're showing a similar thing, that there's a tie between having navigators where people are and the accessibility to enrollment.
Exactly.
And am I hearing you correctly in saying that with what's here, there may be risk at people not being able to access enrollment help in a way that's accessible in their language in a community place that they trust?
Yes,
Ms.
thank you.
Goulet.
Thank you. Yes, definitely. So, we have, I think, over 100 organizations and navigators that are available all over the state that provide services in multiple languages, and they're available across the state. So when you go to the MNsure website, you could actually put in a search for enrollment event, and it pulls up libraries, community centers, community partner venues that they can access navigators. And, the dates come up, the times where they're located. And that would definitely, of course, not be possible if people had to go through the county, which isn't accessible all over the state. So it's definitely a lot more personalized, a lot more unique to the needs of particular populations. And that's why I think we've been so successful in signing up so many more people than what we had before we had MNsure.
Representative Olson.
Thank you.
Representative Albright.
Thank you, Mr. Chair. Ms. Goulet, you obviously come to this presentation fairly well versed in insurance and or benefits. I'm just wondering what inspired you to establish Breva?
Ms. Goulet.
Thank you. So, we started with just the need that we saw, and for becoming a bridge between really communities, especially hard to reach communities, and companies and other state services that provide some sort of health related service. So we thought there was a need to kind of just bridge that gap, because we saw a huge gap in terms of hard to reach communities not getting the services that they needed. And so that's how we started initially, and then we coincided with the MNsure launch. And so we thought, well, this is definitely a great area for us to get into because it kind of services both what we were committed to do. We are a for-profit small company. MNsure has allowed us to build this really efficient, robust navigator program that we have right now. And yeah, so if it wasn't for MNsure, I don't know if we would have hired as many people as we did, if we would have opened as many offices as we did, and be able to provide service to all these communities that really truly needed our services. And now we're able to do so through the MNsure program.
Representative Albright.
Thank you, Mr. Chair. Ms. Goulet, so you're a for-profit, which means that you obviously have a profit and loss statement that you look at on an annual basis that determines whether or not you're an ongoing and thriving concern. I'm just curious in terms of your grant that you received from MNsure. How did that play into your planning? And is it an ongoing or is it a one-time grant that you received from MNsure?
Ms. Goulet.
Thank you, Chairman. So the grant that we received from MNsure is an ongoing grant. So to just give you an example, or to give you just a quick history, we started with a small grant the first year. We got like $30,000. Okay? In that year, we enrolled about maybe 1,200. So we went from that, okay, to getting last year $340,000, and we enrolled, not assisted, because assisted means you've helped so many more people with all kinds of other stuff, but just enrollment into health coverage last year, we've helped more than 13,000 Minnesotans just last year. So just imagine how much cost saving, right? So we went from spending maybe $80 enrolling per person in our first year to like $26 by the fourth year.
Mr. Chair.
So that's a huge investment.
Representative Albright.
Thank you, Mr. Chair. So, Ms. Goulet, if I were to look at your profit and loss, obviously your reliance upon the grants is not a small amount. So would you say that your reliance upon the grant money from the state and from MNsure is what percentage of your overall profit and loss statement?
Ms. Goulet.
Thank you, Chairman. So it's about, I would say, about maybe 40%. But I do want to let you know that this is a grant, that we have to spend 100% of it on the MNsure program, running the MNsure program. And I will tell you, so all those enrollments that we do, we also get a per enrollee reimbursement, right? So for us, that's where we would hope to get a profit. And I was just looking at our profit from last year, and we've literally spent almost everything. Our profit was like maybe 70,000, very small. So we're spending the grant plus a lot of the money that we're getting from the per enrollee payments because we're processing so many people. And the per enrollment rate that we get isn't really enough to cover all the people that so we're literally functioning like a nonprofit at this point.
Mr. Chair.
Representative Albright.
Thank you, Mr. Chair. Ms. Goulet, I think you're proving my point. And I'll summarize here. Your reliance upon the state and MNsure is for almost 40% of your overall operating budget, and yet you even admit that you're relying upon even more than that to enroll people in MNsure, a program that has been wrought with inefficiency. You even said yourself, just imagine if the counties were able to process those people on their own, notwithstanding the good work that you do for the people that you serve. But just imagine if the counties had a program that didn't require an outside vendor to process the people that come to them looking for assistance for county-based programs. Just imagine if $340,000 in the last year wasn't expended on behalf of an outside vendor for a program that was supposed to be implemented and processed by the county. Just imagine if we had a program that served the people of the state of Minnesota in a way that didn't require extra people to help people get what they needed. Just imagine that type of program.
Thank you, Representative Albright. Representative Moran.
Thank you, Mr. Chair. To the testifier and members. So kind of like what I'm hearing is that we have a MNsure that 4 or 5 years ago came into realization and had technical problems. And over the years, it has become more efficient and is now enrolling in an incredible amount of individuals who are now have coverage for themselves and their family. And the one thing I think we know about counties and state is that often they cannot do the work that needs to be done to reach the people back out in the community statewide. For some reason, they are not able to do the work that needs to be done to reach the people who need it in the language in their community the way an outside vendor can do that work. And so what I heard from this testifier is that I heard the awesome work they're doing to make sure that children, mothers, families are getting the service that they need through MNsure, and has done a wonderful, wonderful job of outreach to make sure that they are connecting with people the way the counties and the state have not been able to do. And we hear that because the counties are partnering with an outside vendor. And so as we look at, whereas we want to create a whole new system that makes it more difficult for folks who now have coverage to look at something new. We have 87 different counties. And my question to Representative Dean, we have 87 different counties, and sometimes people move from county to county. And I think I'm hearing you say that each county would do what they do, how they want to do it, with no way of talking to each other, no way of being able to support different community members who are moving from county to county. So as you think about creating something new at this point, that we know anytime something new happens, it takes time for it to gel and to be effective, as we now see MNsure is doing, what would an entirely new IT system built from scratch look like? How effective do you think that would be? And what would that look like in day one? And has the state built other systems from scratch and it's gone well?
Chair Dean.
Well, great question, Representative. And the answer is we don't have such a sweet, awesome track record when it comes to rolling out IT systems for eligibility determination and for program enrollment. Before I got elected, there was something called Health Match, which was a system that was designed to match enrollees with the programs that they were eligible for. And it rolled out with a gigantic and expensive thud, and it never worked, and left us with the legacy system that MNsure then developed on top of. Rather than learning from the mistakes of that, which was too audacious, a rollout too quick, didn't leave time to check to see if the systems actually worked, to just impose a gigantic IT system on the state. We did exactly the same thing again, except there was no backup and there was no net. And so all of the people that couldn't get served were left in the lurch. Counties had to hire people to try to catch up, and they're still not caught up, and it still doesn't work. And we currently, and we will see and hear tomorrow, of the money that the administration wants to spend trying to yet again do MNsure 3.0, where we're going to find out that they're going to be spending not tens but hundreds of millions of dollars in additional money to try to redo this yet again. And so what this does is it sets up a a governance system that says, let's get the right voices around the table to design this thing, and let's not do it until we get it figured out, and let's not pull the rug out from underneath the feet of counties, or more importantly, enrollees around the state. So that's the idea. It doesn't have timelines. It does not have strict design, other than to say that the enrollment period needs to match the IT capability that we have to put it out.
Thank you, Representative Dean, for that plug for your own committee.
So, Mr. Chair, Mr. Chair.
Members, just a note, and I'll get back to you, Representative Moran. We have 12 minutes left in committee. We will be voting at 10 o'clock. We have Ms. Ring, who will also like to testify. And on the list for this testifier, we have the follow-up from Representative Moran, Representatives Quam, Liebling, and Grunhagen to go. Representative Moran.
Thank you, Mr. Chair. So you want to create poor people together? I think I came into this body in 2011, and there was much debate about an exchange or what we was going to do here in Minnesota. We did nothing. And then in 2013, we came into the leadership, and we was up against a crunch of a federal mandate to get something done, to get the federal waiver and to get the dollars that we needed, that was crucially needed for something to happen here in Minnesota. And it did. We did. We put it together, we rolled it out, we got the dollars that we needed to roll it out. And what we did learn from that was that there was an explosion of people on that system, that we found out that the IT system just couldn't handle it. Well, here we are 5 years later, and with any new system, any new technology, anything new, it takes time. And the thing is, what do we learn from that? What do we learn from something that rolls out like this? And I hear you state that, you're going to put a group together and you're going to take your time to make it happen. But, so we want to repeal statutes and rules that authorize and govern the operation of MNsure, right? Effective upon federal approval of the waiver. I mean, what did that look like, Representative Dean?
Representative Dean.
Section 4 of the bill directs the Commissioner of Revenue to seek a 1332 waiver from the administration in order to do that. That would allow state flexibility in designing our own system, and it would allow us to continue to use what we have until we have something better.
Representative Moran.
And is there a cost Mr. Chair, is there a cost associated with this?
Mr. Chair, Representative Moran,
Representative Dean.
the costs within that are within the existing appropriations that are available, that are still available. And I think that we're going to be looking at how those monies are going to be spent. But I think that makes sense for us to look at something that can actually last beyond revenue streams that are going to be coming to an end.
And I end with this last question.
Representative Moran.
And my hope is that, we have a small business in front of us who has been doing a great job of enrolling individuals into our system. And my hope is that we're not here to attack the great work that the business is doing, but see the value that she has brought into a system that many of us thought was broken, that is now, have enrolled more individuals and families as ever before, and that we recognize that she is a job creator, and from what I hear is working like extremely hard and has not received much of a profit, besides the profit that she has ensured that families are covered. And I think that's a job well done. So I just want to thank you for your service.
Thank you.
Thank you, Representative Moran. Representative Quam.
Thank you, Mr. Chair. And, Mr. Chair, I'm confused because I thought this bill was about having a working functional system to support our counties. We've heard a lot about enrollment, even though from 2015 to 2017, the percent of uninsured in the state of Minnesota increased by 2%. So we hear a lot about, oh, this is wonderful. Well, from non-functional to quasi-functional is an improvement. Wonderful would be something that actually works without requiring additional entities outside of it to try and appear functional. And basically this bill is aimed at the end user actually being able to define a system that'll work. And I don't know of anyone that hasn't received, pick up the phone, read your email, issues with the system after they've signed up. And if you talk to your counties, I would love to hear your county people, give me their names, that actually don't have a problem with the system. And then I'll join you in saying, oh, kumbaya with what we've got. But our citizens deserve their counties to have a tool that'll work for them, and they don't have to go to the doctor and find out, oh, I really am not covered, or there's other issue. Something that functions, actually functions. And, you can do this in months in the real world, not years, and you don't require secondary companies to make it work. So let's get back to the issue of the bill, which is providing our counties, the end users, what they've been asking for, how many years now? Thank you.
And Representative Quam does sing a nice rendition of Kumbaya, so if that offer is available, you should take him up on that. Representative Liebling.
Well, thank you, Mr. Chair. And it's been a little bit hard to listen to this conversation because, first of all, I think there's an attempt here to undermine the credibility of the witness by somehow suggesting that she's financially invested in this and that somehow undermines her statement about what's been going on in her experience with MNsure. That's really disappointing. I hope members aren't intending to go down that road. Apparently, something on that yellow sheet from Republican Research might suggest that would be a road to go down. I think that's very improper here. But facts are facts, and MNsure is did start out with a lot of difficulty. It's gotten better. It's not perfect. I think we all know that. We don't need to attack the messenger here. She's just here to tell us her experience of what is working. If we step back from this a second and we think about all the money that's gone into MNsure, which has been a lot, I've heard a couple members now say, I think Representative Albright said, just imagine a program that doesn't take outside help to enroll. And Representative Quam is talking about if you need outside entities to make something work, it isn't working so well. Well, members, just think about, we have this incredibly complicated system of making sure that people have insurance so that they can get health care. There is this layer in between people and their health care that is incredibly complicated that you do need a lot of outside help with. Nobody seems to mind if insurance brokers are taking a commission. They don't work for free, but somehow if it's through MNsure, it becomes evil for people. And I think Representative Dean knows where I'm going with this. If we want a system that doesn't take outside help to enroll, we should get the insurance layer out and have one pool, put everybody in one pool where the risk gets absolutely spread among all of us, and people don't have this complicated decision point, which thing to buy, what will cover me, can I afford, and we do all these things, and we have this enormous bureaucratic layer to make this thing work that isn't even about health care. So yes, I'm suggesting we do need a single payer system, some kind of a one pool system, and then frankly, we wouldn't even need MNsure, and we wouldn't need to send it to the counties either. People would just have health care, which I think most of us here probably agree that everyone should have, since we all do a lot of work around that with rare diseases, for example. Somebody with a rare disease should absolutely have health care they need. Who can dispute that? Representative Dean had a bill. So, we ought to be talking about that. But in the meantime, when we've got the system we've got MNsure, it's working better. Let's not try to undermine the facts about that by attacking a woman who comes here to testify. That's really just improper in my view.
Thank you, Representative Liebling. Representative Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, Ms. Goulet, I'm not here to disparage you in any way, and I know you're trying to help in people who find themselves in a difficult situation. And our current structure of getting health care is probably as complicated as we can possibly make it from a government standpoint. And Obamacare and MNsure seem not to have helped much. I do support Representative Dean's bill. A couple things I just want to bring out. It's already been mentioned. You know, the uninsured rate has actually gone up recently from 4% to 6.3%. So we're actually going backwards in that area. One of the reasons Obamacare MNsure has driven up premiums and deductibles exponentially. People simply cannot afford it. I've sold health insurance since 1978. I have more people canceling, especially business owners and farmers, just canceling their health insurance. They're unable to qualify for a government program, and they're going without. So you know, people are just saying that's enough, all right? But the biggest thing we're actually doing with MNsure and Obamacare, we're expanding government health care. And the problem with that is government health care underpays health care providers for what their costs are substantially. I think Medicaid pays at about 27% of cost, okay? Now, I have a critical access hospital in my district, and I have an employee who's also a customer of mine of that hospital. Just was in my office on Friday. I said, how are things going up there? She said, well, management is telling us to go home as soon as possible. We've got to save money. The facility is under tremendous pressure financially because you're seeing more and more government health care payments and less private insurance. So we're reducing access. We're damaging one of the best health care systems in the world. And as long as we continue down this road of MNsure and expanding government health care, you're going to see less access, not more. And that doesn't mean a person can't have a card that they have from the government saying they have health care. But we had testimony last session where people were waiting 40 days to get an appointment to see a general practitioner. MNsure is a disaster, not just for our citizens, but for our healthcare system. And the continued process down this road is going to damage access and the improvement of our health care for our citizens and not make it better. It has to be repealed. It has to be replaced with private sector principles, and we can bring the cost down and increase access. Last comment, and I know we're running out of time. While the rest of you leave, I'll just keep talking. Okay, no.
Please, no, Representative.
No,
Greenhagen.
I'm just kidding. Prior to Obamacare and MNsure, we had a 9% uninsured rate in the state of Minnesota, 9%. But 6% of the 9% were eligible for a government program but had not signed up. So that means we had a 3% uninsured rate. Now, after spending tens of millions of dollars through MNsure, we wound up with a 4%. And now it's gone up to a 6.3% uninsured rate. So all we had to do was tweak our current system prior to MNsure and Obamacare, and we could have taken care of those 3% and incentivized the 6% to sign up for the government program they were eligible for. We also had MCHA, which took people in with uninsurable conditions. So I could keep going on, and in the interest of time, I
Thank
will.
you, Representative Grunhagen. And thank you, Ms. Guland, for your testimony today.
Just a
Ms.
final
Ring.
comment. Please reconsider your position. You're damaging the situation. You're not helping. Thank you.
Thank you, Representative Grunhagen. Ms. Ring, welcome to the committee. If you could
morning,
please
Mr.
state
Chair
your name for the record and present your testimony.
Good morning, Mr. Chair and members. My name is Julie Ring. I am the Executive Director of the Association of Minnesota Counties. It's a pleasure to be back in this room. I don't get over here very often anymore. Despite being excited to be back, I will be very brief, given the time left. I do want to sincerely and genuinely thank Chair Dean on behalf of the counties and personally for continuing to shine a light on the challenges we have with the current technology system that counties are using. I know many of you have sat with your county workers, have seen the challenges that they're facing in doing simple enrollment tasks in the current technology system. And we need the legislature's help to fix this. As Chair Dean indicated, we have some questions and some nervousness about this proposal, but I want to start by saying that a proposal that puts counties first in helping to design a system that we have to use is something we will always be excited about. In fact, you will see that we will be bringing some legislation forward this year, more broadly than HHS, to talk about system development at the state level related to a number of county systems that we have to interact in and where we engage with your constituents. Because we believe that these systems do have to be tested out and counties need to be at the table in developing them. So you'll hear more from us in general on this topic. To Chair Dean's bill, we do have a number of questions and nervousness around how the proposal would work, and I appreciate your comment that this is at a beginning stage of development. Right now, there is no great mechanism for counties to jointly own a technology system, and we have concerns about how we would own, operate, and maintain it. I do see Chair Davids getting anxious. I'm doing my very best. I think I have, actually, Chair Davids. Sorry, but we are concerned about counties being placed in a difficult situation trying to operate and maintain technology systems. We've been here before asking for more investment in these systems, and we do want to work together with you to make them operate efficiently. It does none of us any good for us to be expending extra county resources to try and make systems that should make our lives easier work. So I'll make a plug to say that tomorrow is County Day here at the Capitol. We'll have 270 county commissioners running around the Capitol, and I'd ask you to reach out to your local folks and ask more about this proposal and the other technology challenges we're facing, and I'd be happy to talk to any of you more in depth individually. Thank you, Mr. Chair.
And she meant that offline. Members, are there any final words from Representative Dean?
Just encourage everybody tomorrow to talk to your counties, and if you haven't done a cubicle ride-along, please ask to do that. It's well worth your while for the committee and for your constituents.
Thank you, Representative Dean, and thank you, Ms. Ring, for your testimony today. With that, Representative Dean renews his motion that House File 2725 be re-referred to the Committee on Government Operations and Elections Policy. All those in favor signify by saying aye. Aye. Opposed, same sign.
No.
The motion prevails, and House File 2725 is re-referred to the Committee on Government Operations and Elections Policy.